talking about a specific sign of prostate cancer. It can indicate non-cancerous problems such as prostate enlargement and inflammation too. Dr. Timothy Quinn is here to break it all down for us. And Dr. Quinn, you had mentioned that you had a discussion with a patient concerned about his referral due to elevated prostate antigen level results. What exactly is this and what was his concern?
Well, this patient was very concerned. Apparently, he was concerned that he just didn't know what was going to happen. And it was the unknown. But basically, he came in about maybe 1 week prior to, and we did a physical exam. We did blood work, and we evaluated his blood work. We contacted him to let him know that we were referring him to a urologist for further testing because he had elevated PSA. And as I said, his primary concern was he didn't want to know because he felt that it would be, quote, dangerous for him to find out, which was his concern.
And what can make someone's PSA level elevated, and what does that mean?
Well, I mean, just to sort of echo the conversation I had with my patient, I told him that you want to know what it is because it could be a number of things. And I asked him to allow me to parallel it or use the analogy of he and his wife lying in a bed at night, getting ready to go to sleep. They might hear something in the kitchen, and it could be a number of things. It could be something like the house settling, which is no big deal. It could be a broom that just fell down spontaneously, no big deal. But it could also be an intruder, someone that broke into his home and was waiting for them to go to sleep so that the intruder could take their lives or cause them harm. You want to know that. You go out there and say, hey, and he'd probably break out of there because he'd be known. And I told him to compare that to an elevated PSA. It could be something harmless, like maybe some inflammation or an infection, which could be treated. It could be BPH, which is benign prostatic hypertrophy, which is treatable. Or it could be cancer, which I explained to him, which you want to know because if you diagnose it early, you have a much more better chance of treating it effectively and saving his life. So after hearing that analogy, he was convinced that he wanted to go ahead and follow up with that appointment with the urologist.
Mm-hmm. And so what do you tell patients that tell you they don't want to know?
Well, I pretty much tell them the same thing as I told my patient, that you want to know because cancer is a condition that a lot of people might get one day. But the good news about cancer is it can be treated in most cases if it's diagnosed early. And for a lot of my patients out there and people in the viewing audience that have that attitude that my patient had, which was, I just don't want to know. I don't want to know because if I find out something bad is going to happen to me, I educate them and empower them with the information that they want to know. Because just like that scenario where somebody broke into your home, theoretically, if you know that that person is in your home, you have a fighting chance. You can call the police, you can protect yourself, but if you just go to sleep not knowing, then you're vulnerable. And it's the same thing with cancer. So we advise everyone to follow up with your medical doctor, get your screenings, and if they advise you to go for further testing, go and find out because you deserve it.
Exactly. Thank you so much, Dr. Quinn. This is important information.